Welcome to animatedteeth.com and our page that outlines the steps of making a dental crown for a tooth. In this first video in our series that explains what the crowning procedure is like for the patient, we cover what's involved when your dentist numbs you up for this work. For most patients, the process of anesthetizing their tooth will be essentially the same as if it needed a filling. So, considering that most crowns are made for teeth that have already had previous dental work, you should have a pretty good idea of what to expect. If you've forgotten, you'll find that your dentist will need to give you some shots. Before doing that, they will probably smear some anesthetic gel in the area. Doing so numbs the skin's surface so you won't feel the initial prick of the needle quite so much. The gel is usually flavored, so expect to get a taste of it. As far as your injections go, your potential for experiencing discomfort varies according to the tooth's location, or more precisely, the kind of tissue in which the anesthetic needs to be placed. We have a separate page on animatedteeth.com that explains details about the different kinds of injections used with different teeth and what to expect with each, so look for it on our website. Possibly different than when placing a filling, your crown procedure may involve more extensive gum tissue manipulation, like in the case where the crown's edges are positioned below the gum line so they don't show. So, to keep you comfortable during this work, your dentist may need to give you some additional injections in the gums right around your tooth. These shots are usually given after your initial dental injections have already started to take effect, which means they can often be accomplished painlessly. But you may feel a sharp pinch for a second or two in some locations, like on the palate side of upper teeth. Once again, our page about injections explains. It will take several minutes for the anesthetic you've been given to take full effect, so your dentist may go ahead and get some of the initial steps of your crown procedure out of the way while waiting. If your crown will be tooth-colored, this time might be used to determine which shade of dental ceramic is the closest match. Also, the dental laboratory that will make your crown will need an impression of the teeth that bite against it. So, that impression might be taken at this point too. Additionally, having a copy of the shape of your tooth before it has been trimmed can be helpful in making the temporary crown you'll wear until your permanent one has been made. So, that impression may be taken also. Once the anesthetic you've been given has had a chance to take full effect, your dentist will check its effectiveness. They may ask you if you notice numbness, and will be interested in specifically where. They may also prick your gums with a dental instrument and ask if you can feel that. If all of your responses are as expected, they can then begin your procedure. As a sidebar, we'll mention that even if you pass your dentist's testing, there could still be some potential that your tooth still isn't as numb as it needs to be for your crowning process. To cover your bases, your dentist will probably set up a hand signal with you that you can use during your appointment to indicate that you have an issue that needs their immediate attention. It could be that you think you've started to feel pain and therefore need them to evaluate, or maybe you just need to cough or swallow. Either way, all of these things are important, so if they don't suggest the signal to use, you should. That way you don't have to worry about getting their attention promptly and without confusion. As one last point, we'll mention that dental anesthetics are effective in knocking out pain sensations, but you will still feel pressure events like the vibrations of the drill as it's used to trim down your tooth, or the pressure of your dentist packing retraction cord around your tooth before taking its final impression. Additionally, you may feel hints of cold sensation like when your dentist's assistant periodically washes off your tooth. However, don't confuse these issues and think that just because you feel pressure or thermal events that you will soon feel pain too. That's not the case. Of course, you'd probably rather hear that from your dentist instead of a video. So, if you do during your appointment, go ahead and use your hand signal and let them explain and reassure you. With that point, we'll go ahead and wrap up this video. Bottom line, numbing up your tooth for its crowning procedure should be pretty much the same as you've been through before. No surprises. And while probably not your favorite part of any dental procedure, one that should be over quickly enough. Good luck and goodbye.